Hello and welcome to Office Hours. I'm Dr. Meghan. I'm a board certified physician in internal medicine, lifestyle medicine, and obesity medicine. And this is really important because I actually prescribe these medications all the time. I actually talk to patients about their weight all the time. I've helped hundreds of patients lose weight, and I'm here to help you too. So every week on Office Hours, I answer your burning questions about weight and weight medication. So if you have a question afterwards, you want to leave it, you can definitely leave it in the comment section down below or on a particular video, and I can't wait to hear from you. So let's get started. As a caveat, as always, I can't answer personal medical questions. So if your question does lean a little personal, I'm going to change it a little to make it more broadly educationally applicable. And if you want to work with me directly, I will leave that info down below as well. So let's get started. First question, in theory, if you've been on 0.25 of Wegovy for at least a month and you're losing weight and your appetite is still suppressed, can you just stay on that dose for a little while? And the answer is yes, you definitely can. So I have another video about like how long is this going to take, and so if you haven't watched that, go check it out. But it gives you kind of a rough idea of when you would expect, or if you're not getting results, like what to do. But I definitely have some patients who lose weight on this earliest dose, and the 0.25 milligrams of semaglutide, either Wegovy or Ozempic, is really not designed to provoke a significant amount of weight loss. It's really there to let your body adjust to the medication so you're not getting blasted right out of the gate. So, but there are some people who respond to this earliest dose. And if that's the case, if somebody had a lot of side effects or their appetite was really suppressed. So you guys know, if you've been on these medications, sometimes what can happen is it way suppresses the appetite, and generally it bounces back, but it takes a little while. And so if that's you, if your appetite is really suppressed and you are losing weight, this is not a case where I would usually be predisposed to escalate that person. If I have a patient who's doing really well, or who's losing a lot of weight, or their appetite, or they're having side effects, or their appetite is really low and like they're eating a couple bites of food per day, that's not the goal. I don't want you to be malnourished. Nobody wants you to be malnourished on these medications. So yeah, that is a good reason to take it a little slower, see where you get to with the lowest dose. And I do have some patients that lose all their weight on like the 0.25 or the 0.5 milligram dose. So again, it really depends on the person, and that's not typical by any stretch, but it does happen every once in a while. So in that case, that is not somebody that I would be rapidly escalating or escalating at all. In theory, can you be on a GLP-1 with no thyroid or thyroid issues? How will this affect the benefits of tirzepatide? So in terms of the thyroid, and in theory, where the boundaries are, for somebody who had their thyroid removed, it would not be a contraindication for them to be on this medication. Although, as a caveat, it depends why their thyroid is removed. Like if they had a family history of medullary thyroid carcinoma, which is a contraindication to a GLP-1 medication, but then they had their thyroid removed, that's definitely someone who should chat with their endocrinologist about whether this is going to be a good fit for them. Sometimes people have parts of their thyroid removed, not all their thyroid removed. So that's a pretty specialized case. And so that's somebody that I would have talk to their endocrinologist and make sure that they were on board with it as well. But if somebody had their thyroid removed for other reasons, usually it would not be considered a contraindication, and that would not be somebody that couldn't take a GLP-1 receptor agonist. Again, very patient dependent, but in theory shouldn't be an issue. Thyroid issues, that it kind of runs the gamut. So if I have a patient who has hypothyroidism, that's not a contraindication. If they have a history of Graves' disease, there's most thyroid issues are not going to be a contraindication for a GLP-1 receptor agonist. However, this is always why it's important to have physician oversight for your medication, because everybody's different. Everybody has a different family history and everybody has a different medical history. So while there are certain contraindications like medullary thyroid carcinoma or multiple endocrine neoplasia type 2, there are other thyroid issues that I wouldn't feel very comfortable starting the medication on. For example, if someone has a suspicious looking thyroid nodule and I'm thinking of doing, they need more of a workup for, is this a cyst? Is this a nodule? Could this be cancerous? If it's a scary looking thyroid nodule, that's not somebody that I will be starting this new medication on. That's somebody that I'm going to be having do more of a workup to make sure nothing serious is going on. So, the bottom line is talk to your physician. If someone has, Hashimoto's thyroiditis, which is very common, that is not a you can definitely be on this medication and that's not a problem. But, if you are not sure, this is a great time to have a conversation with your doctor, maybe see an endocrinologist if you need one, and go from there. But I would say in general, it doesn't compete, or it's not a contraindication for being on one of the GLP-1 receptor agonists. How about anti-DHT medications like finasteride and dutasteride? If so, are they dose dependent, as individuals report increases in weight in doses as low as 1 milligram? I have not seen significant weight gain with these medications. Now, that's not to say that there aren't some people who are going to gain weight on them, but it's not a common side effect. So, finasteride is used to treat benign prostatic hyperplasia or enlarged prostate, and it's also used to treat male pattern baldness. And then dutasteride is also prescribed for BPH. So for finasteride and dutasteride, these are not medications that I have seen as big culprits in terms of medication-induced weight gain. Are there people who, paradoxically might gain weight on them? Of course, that can always happen for any medication, but traditionally, it's not something that I've seen, nor have I seen it in, the medication side effect profiles. And I haven't had patients complain about it either. But if this has happened for you, I would love to hear about it. And of course, as we are treating so many people for weight with medications now, we are always seeing more and more kind of case reports or subpopulations that are having different effects. So if that's coming up for you, I would love to know about it. I will say that something that can happen with both of them is gynecomastia. So that's, enlarged breast tissue in men. So that it's a possibility that people who are feeling like they're having weight gain on these medications, it's possible that one thing they're noticing is increased breast tissue, which, for men, they're not going to usually have. So, and that could be reported as weight gain potentially. Also, sometimes these medications can cause some what we call peripheral edema. So that's just meaning more water retention. And a lot of times that shows up in the lower legs. So more swelling in the lower legs. You can kind of push on them and they kind of leave an indent. So that can happen with these medications as well. And that might also be perceived by some people as weight gain. So, the traditional medication-induced weight gain, hasn't really been seen for these medications, but there are areas of the body that can be altered, that we know can be altered with these medications, and some people might perceive that as weight gain. So that's a really interesting question, and thank you so much for asking. Next question is, in theory, can Contrave be used for someone who had gastric bypass surgery, and also does it have to be taken daily? And the answer is yes, Contrave is a great medication that can be used after somebody had their bariatric surgery. When they start it is really going to depend on, finding the full effect of the bariatric surgery. That's probably something that they would go over with their surgeon in terms of, their amount of weight loss and then when they would think about starting that medication. And you also want to make sure you're not augmenting any side effects that have happened with the surgery because of course everybody's body is going to be different after the surgery. Some people can have nausea, vomiting, bloating. So you just want to make sure that whatever medication you're choosing, that those side effects are under control and they're not going to make it worse. But so that's probably in the short term, that's a conversation a patient would usually have with their bariatric surgeon. But let's say somebody had bariatric surgery years ago, and then they're seeing somebody like me, their obesity medicine physician, because the bariatric surgery got them to a certain BMI, but then we've decided that, the healthiest thing for them is to continue to lower their BMI. Contrave would definitely be one of those medications that could be used in that context. So that is a great question. Thank you so much for asking. And thank you for all the questions. If you have additional questions down below, I love hearing them. You can leave them in the comment section or you can leave them on a particular video. If you want to work with me directly, I'm going to leave that info down below as well. Thank you so much for watching and please be well.